for an update on that horrific bus crash in Limpopo. We touch base now with Newzroom Africa's Nqobile Madlala, where health officials are still trying to identify victims. Nqobile, you're standing by to speak to the Department of Social Development as a number of stakeholders have come together.
Well, yes, they do. I mean, the Social Development Department always plays a role in ensuring that there's that part where there's counselling, especially with this horrific disaster. So this must be very hard for families. You can just imagine how difficult it has been for the couple of days, and that's where they come in. So I want to bring in now Joshua to speak to us, who's a spokesperson for Social Development. Just perhaps to have an understanding, we know that there's a little girl that is 8 years old currently in hospital. We can just imagine what she might be going through, even though she hasn't spoken about the accident, according to the Department of Health. Can you briefly explain to us what is the role that social development in this province will be playing?
Well, immediately after the accident, what we did is that we understood the gravity of the accident and what needs to be done. We immediately put a team together of social workers, highly experienced, obviously because of the gravity of the accident. What we then did is that we based them here at Evelyn Lekganyane Clinic, which is very close to the two churches, but importantly now to St Engenas. The plan has always been that the family members, we knew that they will need debriefing, we knew that they will need counseling. We have based them here. They are constantly here. As I'm talking to you now, they're forever on standby until the whole ordeal is dealt with. So we are on standby to provide psychosocial support, particularly to the family members. And of course, now that there are developments with the survivor, we are anticipating to continue to providing support to the family. We have not yet made contact because, of course, we obviously needed to give them space. We needed to give Department of Health space to provide, emergency service and so on. But we are on standby to provide counselling, and we hope that the family members will obviously get some relief from the counselling that we're going to provide.
You speak of high expertise. How important is it for the people that are going to be taking care of this to come highly recommended?
Well, look, it's very important. Our starting point is that now that it's Easter, we know that we need to put a team on standby for such eventualities. So it's very, very important to put, particularly in this case, highly experienced social workers, so that they are able to better deal with the situation. So we take this matter very, very serious. That's why we will be on standby, we will be on the ground until we are quite confident that we, reasonably have been able to deal with this ordeal.
And in this situation, obviously there's a young child there. How do you usually deal with these situations where there's a young person? I mean, 8 years old is very young.
Look, I may not be able to give you technically what is it that we will do from the social, practitioner's point of view. But we know that there's going to be a high need of trauma counseling from both the parents and the victim. So they will be able to technically deal with the trauma of what happened. So we're quite confident with the team that we put together that they will be up to the task, so that we are able to provide some relief, which we think is very, very important.
Thank you very much for speaking to us. That is the spokesperson for social development in Limpopo. Did you just speaking there to us about the issues that obviously will prevail after the incident? You can understand that there's going to be a lot of trauma for families, but also a trauma for the little girl that is a sole survivor that we know is in good spirits because the mother is currently around in hospital. But what we're hearing from the Limpopo social development is that they've got quite a number number of people with great expertise to ensure that they can control the situation as much as they can. And of course, we are still reaching out to the Department of Health, which we're expecting to speak to them a little bit later to find out just how far it is at this point, especially when it comes to that DNA process that we know is currently underway in the background.
Nqobile, Madlala, thank you very much for that update.